Here we'll talk about confounding. It means to mix up or to confuse. So this confounding factor is the one which is associated with both exposure and the outcome, and itself is a risk factor. That means it independently affects in causation of the outcome. For example, if you want to do this case control study on chronic alcoholism and the esophageal cancer, that means you want to see whether this chronic alcoholism will lead to esophageal cancer or not. In often cases, people who drink will also smoke. So the smoking is associated with alcohol, and also the smoking has this independent effect in causing esophageal cancer. So smoking here is associated with the exposure, that means alcohol, and also the outcome, esophageal cancer. So it is a confounding factor, right? So this confounding factor can mislead the estimation of the outcome by the interpretation bias. What do you mean by it? So we don't know what to estimate, right? So if you are studying a patient with the esophageal cancer, and in the past history you get to know that they were alcoholic and they were smoker. So you don't know whether the smoking caused the esophageal cancer or the alcohol caused the esophageal cancer. So this confounding factor can mislead the estimation of outcome by the interpretation bias. You don't know what to interpret, whether the alcohol or the smoking is a causative agent. So to prevent this confusion, we'll have to neutralize this confounding factor. For this, you'll have to take the subjects who do not smoke. For example, in the case control study of this alcoholism and the esophageal cancer, take the cases, that means the cases are the people who have this esophageal cancer, and in the past history they should be drinking only alcohol, they shouldn't be smoking. So take that group of people who were only alcoholic and do not smoke. So that is about the cases. And now coming to the controls, take the people who do not have the disease but they are chronic alcoholics and they do not smoke. So this is how you can utilize this confounding factor. So it can be done by matching, and there are other methods also like randomization, stratification, statistical modeling, and the restriction. So these are the different methods to control this confounding. And there is this other example where steroidal contraceptives can lead to breast cancer, and also this age acts as a confounding factor because increased age will increase the risk of breast cancer. Increased age is associated with steroidal contraceptives. So you don't know whether this breast cancer is because of the increased age or is it because of the steroidal contraceptives. So what do? Again, we'll try to neutralize this confounding factor. How will we neutralize here? We'll prefer this usually younger age group of people because older age is more prone for breast cancer, right? So we'll prefer the younger age group of people, and also we'll take the same age group for controls and the cases. So that's how you can neutralize it. So let us summarize the whole thing. Confounding factor is the one which is associated with exposure and the outcome, and itself acts as a risk factor. It has an independent effect in the causation of the outcome. So this confounding factor can mislead the estimation of the outcome by the interpretation bias. Write about the two examples like alcohol, esophageal cancer. Smoking here is a confounding factor. Steroidal contraceptives causes the breast cancer. Age here is a confounding factor. So to prevent this confusion in the studies, we'll have to neutralize this confounding factor by matching in case control studies, and there are some other methods also like randomization, stratification, statistical modeling, and restriction. This is about confounding. Bye.